Hello everybody. You know what? May 6th. What a great day. I came over the Blue Bridge today. You know, that's one of the highlights of this new job is being able to drive over the Blue Bridge twice. I know that people think that's funny or unusual because maybe they get stuck in traffic maybe 1% of the time, but the rest of the time it's absolutely a fantastic drive, and the river today is like glass. And if you like to boat like me, then a day on the river when it is like glass is a great thing. All right, hey, what are we going to talk about today? I got two big topics today. One, I'm going to talk about sexually transmitted diseases. Secondly, we're going to talk about you thinking about running for elected office. You know, some people might laugh and think, how do those two weird topics go together? But they don't. They don't go together. But, you know, I told a friend of mine that what I was going to talk about today with STDs, and this friend said, oh, that's so depressing. Yeah, it is. It is depressing. But I'm going to tell you, let me tell you why I want to talk about this today. STDs, sexually transmitted diseases, are among the most common infection diseases. 20 STDs have been identified. 20. More than that, actually. More than 20. STDs affect 19 million people every year, men and women. And you know what it costs us as a nation to treat that many people? $14 billion. $14 billion. That's why I want to talk about it today, because it is a big, big health issue. So I have invited our local health officer. Her name is Dr. Amy Person. See, I told you, Amy, I would do that. Dr. Amy Person. She is, she basically runs Benton Franklin Health District. Thank you so much for joining us today.
Well, thank you for having me.
So, are STDs a big deal or not? Is all this set up over nothing? Are they a big deal?
You know, they are a big deal. They're a big deal in terms of the numbers. Even in our area, sexually transmitted diseases are the most common infections. Probably the most common by far is chlamydia. Last year we had over 1,000 cases in Benton and Franklin counties. If I added up all of our other infectious diseases total together, I don't think it would reach that. So it's a problem, and it's been a problem. It still unfortunately remains a problem.
Yeah, I was thinking about that the other day, and you know, we, wow, 30. I mean, obviously they've been going on as long as humans have had contact with each other, but it just shocks me that we haven't done a better job as a group of people in educating ourselves. So, why? Why haven't we?
Well, some of it I think is anything to do with sex tends to be taboo. So it's a subject that's oftentimes hard for people to talk about. It's hard for parents to talk about. Sometimes it's hard for even physicians to talk about it with their patients. You know, I think it's hard sometimes even, you know, to discuss the subjects in, you know, schools, churches, anywhere. So I think over time there's always things that are hard for people to broach and hard to not to separate the disease from sort of a moral judgment about it.
Yeah, you're right. Yeah, we do put a moral judgment on it. If we could do anything today, I would really like us to break down some of those concerns, some of the things that hold us back from talking about it, and particularly from parents talking to children about it. So anyway, let's talk about chlamydia. Why is that a problem here? Why that's a big problem that you see?
It's a problem because it tends to be more common in our adolescent and our young adult females. And unfortunately, chlamydia typically will not have a lot of symptoms, so many people can be infected and not realize it. So one of our goals has always been to try to increase how often people are getting tested, not just waiting until they have symptoms, but making sure that men and women that are at high risk are going to their doctors to get tested. I think one of the barriers that we've seen in the past, which will hopefully now be changing with some of the changes in our healthcare system, is that people haven't always had access to go seek health care. And so oftentimes people that were higher at risk, which tend to be the ones that are poorer or younger or who may not have had insurance or been close to a doctor, haven't been able to seek treatment. So, one of our messages is that, if you're young and if you're having sex, you need to be getting screened for these.
Well, parents, sheesh, they wouldn't, I can understand how people would have a very difficult time broaching this subject to teenagers because they don't want teenagers having sex at all anyway. So if you talk about STDs, then you're acknowledging that is, a possibility. How do you get around that? Do you just talk about STDs in general as a good piece of information that maybe you'll use as an adult, or what?
Well, I think part of it is recognizing that even if you're not talking about it to your kids, that they're probably hearing about these things from other places. Particularly these days with social media and the internet. I mean, there is lots of information, and unfortunately there's lots of misinformation out there. So I think if parents think by not saying anything, their kids won't have any idea that sex happens, I think they're probably mistaken about that. So obviously I think we see even in places where people don't talk about this, we see these diseases. So I think kids are aware of it. So I think it's better to bring up the subject, when it's where you can give information that is accurate, and so they'll understand, particularly that they'll also understand the risks. When we say we're talking to people about sexually transmitted diseases, we're not saying, yeah, we know you want to have sex, here, go do it, here's a condom, have fun. It's about having a responsible conversation about, if you're going to make that decision, what are the risks, what do you need to think about, and I think particularly for our young girls, it's also teaching them that, that they have the power and the self-confidence to say no. Because we find, particularly with some of our younger teenagers and even our young adult females, that oftentimes there can be intimate partner violence or even some sexual coercion into their decisions about having sex. So I think talking to the kids is also about telling them, you can make those choices. You don't have to do something because, your boyfriend says, if you don't do this, I'll leave you.
Yeah. I think a lot of adults might feel uncomfortable talking about it simply because they don't know enough. Where would you send some adults to get enough information to be able to talk about it?
The Washington State Department of Health and the Center for Disease Control and Prevention, the CDC, both those websites have a lot of good information about sexually transmitted diseases, about those choices, and they also have information about how to talk to kids about it. So putting things in perspective for where people are developmentally.
I was looking up a few things before our conversation today, and one of the really interesting things I came across was a good place to talk to your teenagers is in the car, where like both people are sitting in the front seat, and I've seen this happen a lot. People have incredibly deep conversations when they're driving in a car because they're looking forward. They don't have to look at the other person. They don't have to look at their reactions and stuff. And so a lot of times really intimate conversations will happen that way. And that was one of the recommendations that I saw on the CDC website. So I thought that was pretty interesting.
Plus the fact that they are a captive audience, literally.
Well, yeah,
Yes.
Absolutely. You can't get away. Yeah. Well, what does the health district do in terms of, you're not treating people, are you? What is your role?
The role of the health department is basically to do surveillance. So when laboratories have a positive test for a sexually transmitted disease, or when the doctor's office or a medical provider has one, they report those to us. So we kind of collect that information. And that helps us to understand what groups are kind of at highest risk. So yeah, treatment is done by the providers. So I think years ago, health departments used to do more as far as doing testing and treatment, but unfortunately, as we've lost a lot of our funding to provide actual clinical services, our role now is primarily with surveillance.
All right, well, if you've got a question for Dr. Person, I want you to give us a call. Our number is 509-547-8726. We're going to take a break, but when we come back, we want to ask the doctor some more questions about sexually transmitted diseases here in the Columbia Basin. Stick around. You're listening to News Talk 870. This is Meet in the Middle. I'm Christine Brown. We're here today, May 6th, talking about sexually transmitted diseases. I know it's a difficult subject. I know it's depressing and all, but it's important that we talk about it more. Why? Because 19 million people every year have an STD. So, yeah, we want to talk about it. My guest today is Dr. Amy Person. She's with the Benton Franklin Health District. Dr. Person, tell me some of the basic symptoms. Yeah, just the basic symptoms. You know, there are more than 20 different kinds of STDs, but if you got these symptoms, you can think, I got a problem here with an STD. What would that be?
Most commonly, the symptoms that you'd see, if you have them, would be some kind of discharge or drainage from either vaginal or genital. Sometimes you can have sores in those areas, abdominal pain, you know, a lower kind of stomach ache, or pain when you urinate, when you go to the bathroom. Those would probably be some of the most common if you're going to have symptoms. But I would always caution people that the vast majority of people who have a sexually transmitted disease do not have any symptoms at all. And, you know, even to the other extremes, some of our sexually transmitted diseases, obviously like syphilis or HIV, can have much more widespread symptoms that involve other areas of the body. Washington, in the last month, has been one of 2 states that has seen an increase in ocular syphilis. So people who have acquired syphilis that actually develop blurred vision and have even gone blind because syphilis has traveled, you know, into their central nervous system. So
this is some serious stuff. This can be very serious. It's not just uncomfortable. It can be very serious to your health. So I guess I'm looking at the whole area of prevention, and there unfortunately is no way to know. There's no way, for example, that somebody's fingernails turn purple and you can easily look at them and say, they've got an STD. You don't know. You don't know. How can you best protect yourself?
Well, I think the ways that you can best protect yourself is, you know, like with anything, you want to be that, you know, informed consumer. I guess I would say you want to think about the choices that you're making. There are a couple sexually transmitted diseases that you can absolutely prevent yourself from getting. Human papillomavirus, which causes genital warts. There's a vaccine for that. Hepatitis B, which actually is a sexually transmitted disease, is also prevented by a vaccine. So immunizations are a way to prevent a couple of those. You know, again, if you're going to make the choice to be sexually active, you want to make sure that you're doing it when you're in your best frame of mind, so not when you're under the influence of drugs or alcohol, or engaging in other high-risk behaviors. And if you do choose to engage in those kind of behaviors, you want to make sure that you are getting yourself tested on a regular basis to try to pick up infections if you have acquired them.
What about the role of a condom? Is that pretty important?
Yes, a condom is going to be our most effective way if you're having sex to prevent yourself from getting a sexually transmitted disease. And of course, that's a condom being used, you know, properly. So it's not, you know, when you're in the middle of sort of the throes of doing that is not the time to think about how to put on the condom. So again, that's why it's important, I think, for people to be educated about what they need to do.
Mm-hmm. I don't know any statistics on this, but you know, it used to be that men carried around a condom in their wallet. Well, I sure hope today that women are carrying around condoms in their purse.
That's probably is a good idea. And actually, we tend to discourage men from carrying them in their wallets because they've discovered that latex in the condom starts to break down with heat, so probably carrying the one around for 10 years might not be any more effective than not using one at all, unfortunately.
Well, I'm sorry for that person that hasn't used it in 10 years. Oh, okay. All right. Well, that's some very useful information, and I want to thank you for sharing that with us. I want to switch gears because that's enough sex talk for the time being here. What else is, what other big public health issues is our local folks facing here?
Well, we're keeping an eye on some of our vaccine preventable diseases like pertussis, or what they commonly call whooping cough. In the state of Washington, this year we've seen the numbers starting to rise again, and those of you who are around in 2011 remember that we did have an outbreak at that time. So we are keeping a close eye on that. That one of the groups that we really want to make sure are taking the necessary steps to protect themselves are pregnant women. There are new recommendations now that women, when they're pregnant during their 3rd trimester, should be getting a Tdap, which is the tetanus, diphtheria, pertussis vaccination, and they should be getting that with every single pregnancy in order to protect their newborn babies. So we want to make sure that message is getting out. We're keeping our eye too on mumps, measles. There's been cases of those across the state. So unfortunately, a number of the diseases that we hoped that would have been eliminated by vaccination, we are starting to see more of, particularly as more people are opting to not get vaccinated.
Yeah. Well, we could spend a couple hours talking about the issue of vaccinations, but I'm not going to touch that one today. Dr. Person, I want to thank you so much for coming and talking today about STDs. I know it's a tough subject, but if anything, I hope that our discussion today will mean that people might go and Google it and learn a little bit about it and, boy, talk to their children about it. That's what my hope would be.
Mine too, so thank you for the opportunity.
All right. You know, this is News Talk 870, and what are we going to talk about next? Well, I told you that STDs weren't necessarily, the same as elections, but some people might put them into the same category. Here's the question I'm going to pose. Hey, have you ever thought about running for an elected office? Well, maybe you should. We'll be back in a moment. Okay, let's get serious though. Let's talk about it. Jerry Martin is here. He is from the local Republican Party, and he's the, basically, Jerry, you're the head of the nominating committee, isn't that right?
Correct.
Yeah. So coming up for this election cycle, there are mostly local jobs available, right?
Correct.
So what kinds of things is the Republican Party doing to hopefully encourage more people to get involved?
Well, first, Christine, I'd like to thank you for inviting me to join you here today.
Oh, good.
And I miss seeing you on the evening news, so I'm really glad you have this radio talk show.
Oh, thank you. Thank you. Me too.
I'd like to tell you about what we're doing in Benton County. I'm with the Benton County Republican Party, chair of the nominating committee. And until last year, we really hadn't done much in what's called nonpartisan races. That's the city council, school boards. But last year we decided we needed to pay some more attention to that. So we modified our bylaws to include provision for nonpartisan offices. And we also remembered that famous quote, "All politics is local." Speaker Tip O'Neill, 1962. Remember that?
Yes. Mm-hmm.
And so we decided that right here locally, in our case Benton County, is where we can be most effective. So to start to implement our program, the nominating committee sent out letters to all 55 elected officers in Benton County, all the elected incumbents. And we basically asked them, do you plan to run for re-election or not?
Mm-hmm.
And if not, then that means that's an open position. And we have an obligation to try and recruit good, well-qualified candidates for that position. So that's what we've been doing.
Okay, let me just add to that, Jerry, because that can't be the only voice. Even if somebody is going to run again for that same spot, I would recommend that people not let that hold them back. If somebody isn't going to run for a particular seat on the Pasco City Council, don't let it hold you back. If you think you want to be in that seat, regardless of whether or not somebody's already been there, I say do it. So you represent a different strategy.
I
Okay.
do, but you have a really good point there. If any people who are listening to this attend city council meetings or school board meetings, wherever you are, and if you think that the folks that are doing that job are not doing it right or not doing it well, and you think you can do it better, you should be running for office. But to
Yeah.
continue my
Okay.
my thought, we sent out 55 letters to elected officials in Benton County, and I understand you have Matt Beaton on the phone, so he can speak to Franklin County.
Yeah.
But we got 21 responses to those letters, which is a pretty good response. And we identified 5, maybe 6 open positions where
Mhm.
people have said,
Mhm.
I'm not going to run. So we're actively recruiting.
What are those? Would you tell us?
Sure. There's an open position on the Benton City Council. There's an open position on the West Richland City Council, one on the Findlay School Board, one on the Prosser School Board, and one on the Richland School Board. And
So
there may be
those
one
will
more.
be open. Nobody is going to run for those at this point.
The incumbent
okay?
is not running.
Okay. Yeah. All right.
So it's open to anybody. So we're actively recruiting for those positions. And the filing week is next week, Monday through
Right.
Friday, May 11th through 15. And if you're interested in those open positions or running against any incumbent, check the county auditor's website in Benton County or Franklin County. Check the county auditor's website. You'll find all the information necessary there for who has already filed, what it takes to file, and more information about the position as well, so you really know what you're getting into.
Some of the points that you made were made in the Tri-City Herald recently in an editorial that they wrote about. They're basically appalled by, they see some of the candidates coming in for the editorial board and they've never attended meetings, they don't even know what the current issues are, and yeah, so we need a government that is reflective of the community and that people are informed about what they're doing. Jerry, let's turn to you. What kind of advice would you give for people thinking about running?
Well, first, I'd agree with everything Jay just said.
Oh my gosh,
Those are
you're kidding me.
Important points.
I like that.
Our goal is to increase the number of well-informed voters. And so we encourage people to do things like attend your school board meetings, attend your city council meetings, know what's going on in the community, voice your opinion. And if you decide that an incumbent is not doing the job and you could do it better, and you know what you're talking about, you should be filing for office next week. We've talked so far about city councils and school boards. There are a bunch of other positions that are open next week. Things like port commissioners, hospital district commissioners, fire district commissioners, water commissioners, and even the cemetery commissioner.
Mhm.
And some of those jobs are a lot easier than some others. So if you want to take just a little bite, take a look at some of those positions. You can look them up on the county auditor's website, find out what's going on, talk to some of the people that are already in those positions, and you might decide to run for one of those.
I want to know specifically what the two parties are doing here to make the elected bodies more representative, more reflective of our community dynamics. And I'll just say it out front. We have a huge Hispanic population, and those people should be reflected on our elected positions. And, you know, here's what I want to share with folks coming up in our final segment here. I want to share with you this story. It's a really unusual story of how a pizza saved a life. Can you believe that? Yeah, a pizza saved a life. That's
Yeah.
coming up next. Hey, I want to tell you how pizza saved a life. Well, here's the deal. There was a woman in Florida. She and her several children, 2 or 3 children, were being held hostage. She was able to convince the hostage keeper, some relative or maybe a boyfriend or whatever, that they order a pizza. So she ordered a pizza online, and in the comment section, the Pizza Hut, the local one, she put down, "Call 911, I need help," and the police showed up. That is an amazing story, is it not? All right. Hey, I want to share with you just a thought for today, because I like to do that. Everything in moderation. That's my thought. Everything in moderation, including moderation. That's what Oscar Wilde said. Anything that we do needs to be considered in that. We can usually keep ourselves together.
Especially on the heels of yesterday.
On the heels of yesterday?
Cinco de Mayo.
Oh, yeah. Okay, that's just silly. It's become just a crazy drunk holiday, huh? Let me tell you about what we're going to talk about tomorrow. You know, first of all, I just love this. This is so much fun to me to be just making up what I want to talk about. Well, one of the things I really want to talk about is the drought that we're looking at here locally. And what I want to know is, what does it mean for you and me? I mean, the number one thing is, what does it mean to me watering my lawn? And I'm thinking that you want to know that too. And also, how does it relate to agriculture? Chuck Freeman from KID, Kennewick Irrigation District, will be my in-studio guest on that topic, and we'll be taking some of your calls as well. Secondarily, we're going to talk to some people from the Reading Foundation. We're going to talk about reading and children. I don't know if you know it or not, this gets bantered about quite a bit, that we are ranked 14th in the world when it comes to education. 14th in the world? Thought we were number one. Well, we are not, and we still sometimes have this crazy bravado that we are number one, but we are not in the area of education. And somehow, you know, you cannot help but think that reading could have something to do with that. So what can we do to make that happen? Hey, we've got a little bit of time. Oh, not much, but John McKay, who's our producer,
Yes.
sitting in here, we can talk just so briefly about the NFL. Finds the Patriots probably deflated their footballs during the AFC Championship.
Well, it
Wow.
was, you know, it was a controversial story, and now there's been some new information about it. So it just keeps getting juicier and juicier.
Oh, I love it. We just pull back the onion, peel it back one at a time. Hey, you know what? This was a lot of fun today. Why don't we do it again tomorrow at noon?